our work is focused globally through things like vaccination programs, improving agriculture, family planning, and many other things. Vaccines have been a big part of what we do in the Gates Foundation, and in many ways the birth of the Gates Foundation is linked with vaccines. Bill and Melinda in the late 90s were still very involved in Bill's case, managing Microsoft. His ideas about philanthropy is that it could wait. He would do that, but later in life. And then he learned that this disease, rotavirus, this virus he'd never heard of, was killing hundreds of thousands of children every year, and that there was a vaccine to prevent it, and that it was not reaching children. And it was learning that compelled Bill and Melinda to pull forward their commitment to philanthropy and to really begin the Bill and Melinda Gates Foundation and to get started in their work in global health. And so in many ways, vaccines are a big part of the history of the foundation and part of the, if you will, the compelling moral argument that they had for getting involved in global health in the first place. A vision of vaccines through the decade of vaccines. This is an international effort, an effort that was endorsed by all the ministers of health at the World Health Assembly just a couple of years ago, that is focused on extending the benefits of vaccination to everyone, everywhere. And so we do this in part by investing in country programs and partnerships, in strengthening immunization systems, and helping to introduce vaccines that protect against diseases that have not been previously preventable. And also in part by advocating, by using science, information, and education to help people understand the potential benefits. In vaccine delivery, we organize our work around 7 main fundamental areas: accelerating access to new vaccines, supporting the eradication of polio, ensuring the financing that we need to sustain vaccination, improving the affordability and supply of vaccines, something that's been talked about here, and then improving systems through making them more data-driven, through increasing coverage and equity, and improving immunization coverage for older children and even young adults. I think that we've made tremendous advances, and many of us will know those well, and we'll talk about some of those. But even with those advances, there's an estimated 1.5 million children that still die each year from vaccine-preventable diseases. And so I think we can all agree there's much more to be done. If you look at this graphic, which illustrates what are the types of diseases that are claiming the lives of children, you can see a big chunk, all of that on the right-hand side. Those are all areas where vaccines can help to protect children from causes of death and evidence to what remains to be done. So our goal at Bill and Melinda Gates Foundation's vaccine delivery team, all of that work really comes down to the work that you do with your communities at a community level to make sure that we extend protection to everyone who needs it. So some of the areas in which we've seen progress are innovative partnerships. I would argue that this meeting today is an example of one of those. This is not a meeting that happened long ago in the past. And it's a really exciting trend that we're starting to develop these partnerships. We have seen great reductions in child mortality and new developments in technology that helps to deliver vaccines or make vaccines more safe, more effective, but of course, continued challenges. One innovation and partnership that has formed over the last 15 years that I want to say a word or two about is something called Gavi. This is the Global Alliance for Vaccines and Immunization. It's something that started in the year 2000. And this has made many, many things that were virtually impossible in the past very possible today. It's a very important partnership. It's a very important part of what's achievable. And it's a potential very important partner for you in this room as well. So Gavi is an alliance that includes all of the countries that are at risk of vaccine preventable diseases and that lack the financial resources to do everything that they need on their own. Many of the African countries are part of the alliance. It includes international organizations like the World Health Organization, UNICEF. It includes philanthropies like our foundation, international donor governments. It also includes vaccine manufacturers and civil society organizations. They're all part of this partnership. And through Gavi's support, it is able to help accelerate access to new life-saving vaccines and strengthen systems that get those vaccines to be delivered to everyone everywhere. And just as one example of the kind of success that is possible through Gavi, here's an example. The expanded program on immunization, we use the acronym EPI, but the expanded program on immunization started in 1974. At that point in time, only about 5% of the world's children were receiving a limited set of vaccines. Only 5%. And by 1990, up to 80% were receiving that limited set of vaccines. But we hadn't added any vaccines to that system. Through Gavi, we've been able to both increase coverage with the existing vaccines. That's the blue line. The blue line's gone up over time and is continuing to go up. But in addition, all those other colored lines along there, the pentavalent vaccine, the pneumococcal vaccine, the rotavirus vaccines, we're now adding those vaccines. We're now adding protection against those life-threatening causes of pneumonia and diarrhea and meningitis to the package that we can provide to children. And without Gavi, it took 20 years to do that even a little bit. And now we can do it really fast with all these vaccines in all of these countries as a consequence of Gavi. So what does today's immunization landscape look like? Well, on the new vaccine introductions, as I've just showed you, we're seeing a lot of progress. More than 90 of the low and middle income countries of the world have introduced one or more of the new or underutilized vaccines. We're very close to ridding the world of polio, as you all know. Measles, a major killer, is really, really down. More than 78% reduction in just over a decade. And another important cause of infections that can harm newborns, a virus called rubella, that when it infects a pregnant woman can lead to complications in her newborn baby. That is completely gone from at least one region of the world already, and that's because of vaccines. So if we look at Gavi's projections and their achievements, you can see here the dashed line was their projections. They're ahead of schedule on the projections and hope to get more than 240 million children immunized between 2010 and 2015. We've also seen mortality drop substantially, even ahead of what we had targeted. And we're ahead of where we had projected to be in terms of preventing deaths, averting deaths through vaccination with Gavi. Looking at just in Africa, we can see lots of progress in many, many different ways. I would call out a couple of these in particular. Look at measles. Anybody who's in this room and has been part of measles during an epidemic knows how devastating that can be, right? It burns through populations rapidly. It finds all the susceptibles, and it makes them ill, either sickening them, killing them, or sometimes leaving them with long-term disabilities, blindness, or other problems. And that's down massively as a result of vaccination. We need to update the line with polio. It's not 13, it's 0. 0 cases for the last 18 months.
Wow.
And things like tetanus and neonatal killer of neonates vastly down. But we also know that these countrywide or region-wide data mask some differences that remain. Within the continent, there are differences in the level of coverage of vaccine. And within each one of these countries, we know that lower down there are even more differences and remaining inequities within the countries. This is a very complicated slide, and it's very small writing, so I'm not going to test you on whether you can read it. But basically, everywhere that one of those dots is a colored in circle, it's an African country that has added a vaccine, a life-saving vaccine. Every open circle is a vaccine that hasn't been added to their program. I would argue to you that every one of those colored circles is a success we should celebrate. Every one of those open circles is an opportunity for us to extend protection to children. And the very small numbers around the outside, those vary from more than 90% to down to 24%. Every one of those numbers that's less than 90% is, again, a challenge to us to extend protection to make sure that these vaccines reach everyone in every community that needs it. We've talked already about measles. I've just come from a meeting of the meningitis vaccine project. What has to be one of the most exciting successes of the last 15 years. This is not only a vaccine success, this is absolutely an African success story. This is a vaccine that was custom built for Africa. It wasn't made for anyone else, just for Africa, for the highly affected communities. Many of you, I imagine, in this room have been a part of communities devastated by epidemic meningitis. You've seen the disruption, the disability, the types of things that happen during an epidemic of meningitis. Many of you may know survivors. Because we built this vaccine specifically for Africa, used it to vaccinate almost 250 million people, that disease is virtually gone from Africa. It is an incredible success story, and one that demonstrates how when we generate vaccines that African communities want, they respond. They line up to get that vaccine. And of course, a polio-free Africa. This is another historic achievement. It is now 18 months since that virus has found anybody on this continent. It's an amazing accomplishment, and one that has been done by going community to community to community throughout the continent. So, amidst our progress, some challenges, stagnating progress, some leveling of coverage. Some of those numbers on the outside of that arc have been steady at a level or even declining to levels that we do not want to see. We know that there are inequities in access within countries and within communities. One example from polio. One of the things they found with polio when they started working really hard in northern Nigeria is that many of the communities where the cases were occurring were communities, they were just on the edge of the border of one of the LGAs. And what happened was, I thought that community was in Imrana's LGA. Imrana thought it was in my LGA. And so neither of us were looking after them the way that we should have. We're learning about where those communities are and how to extend coverage and equity to reach all of them. But we need to continue to do that. There's inefficient and outdated supply chains and systems on the supply side that we need to address. If you work with your communities and say, listen, immunization protects you, it makes you strong, but we can't supply the vaccine to the people who demand it, they're not going to keep coming back. We need to work together, both on the supply side and the demand side. And we all know that there's a shortage of trained healthcare workers to deliver these vaccines in some places. I talked a little bit about the supply chains. I would just flag for those of you who are staying for the ministerial meeting, we're going to be having a launch on Thursday of an exciting new initiative that can help to just completely upgrade the supply chains of Africa and other developing countries in ways that they will not solve all of our problems, but it will be one less unreliable part of the systems, be one less headache, be one more way that we can help to extend access to vaccines for countries. But we will still have these coverage shortfalls, which I alluded to earlier, and hesitancy and demand side are going to continue to be a legitimate concern. And this is a very important place where I hope that our partnership together can help you to help the communities where this is an issue. This is a table with results from surveys that have been done in a number of different countries. And I want to make a point here. You'll see that one of the countries in the middle is the UK. This is not an African problem. This is a global problem. Communicating, as we heard earlier, sometimes we're not great communicators. We need to communicate and make sure that parents have the information that they need so that they don't hesitate or refuse vaccines, and it's a challenge everywhere. What you can see is that the vast majority of people are not hesitant and not refusing. If we expand this a little bit and look deeper into where the sources of the hesitancy are amongst the parents that reported hesitancy, what you'll see are that they may have a combination of different things. Sometimes they would say, I didn't think that the vaccine was needed, right? Well, clearly that's about educating them about the diseases and the way that the vaccine can protect. But sometimes it's about a bad experience with a previous vaccine, other beliefs that maybe other sources of protection are important, and some, 15 in this case, highlighted religious beliefs. There's a really strong case for you as religious leaders to help your communities to understand better the role that vaccines can play in protecting themselves and their communities. So how can you help? You can help by spreading the word. First important point to make is that vaccines are very, very safe. I want to extend a little bit on this, on how the testing works. The testing that vaccines go through before they ever reach the children in the communities is incredibly extensive. The pneumococcal vaccine, the vaccine that protects against the most important cause of pneumonia deaths in children, is actually a combination of 13 vaccines. It takes more than 1 year to make a dose of that vaccine. The vaccine goes through more than 1,000 quality steps before they release it to come out. They do a little step, they check it. Only if it passes that step does it go forward. And they do that 1,000 times. The paperwork that they submit in order to get the regulatory authority to approve this, it's staggering. It's staggering. It's literally hundreds of thousands of pages of careful analysis to make sure that the vaccine is safe and effective. It goes through rigorous evaluation in the field. I had the privilege of working on one of the vaccine trials that took place in the eastern half of the Gambia. Every step of the way we documented everything that happened to those children to be sure that we knew that the vaccine was safe and effective. Side effects do occur. When you vaccinate somebody, oftentimes they'll say it hurt, or maybe there was some swelling, or maybe there was even a little bit of fever in the baby. Ironically, sometimes that's an indication that the vaccine is working, that it is provoking the immune system of the child to generate the immunity that they need so that when they see the real bacteria or the real virus, they're prepared, their body's ready, they can tackle it. So we need to acknowledge that there will be parents who will say, well, my baby had a sore arm, or my baby had a little bit of fever. That's true. But actually your baby is protected afterwards, and that's the important part of the vaccine. Serious vaccine side effects are incredibly rare. Incredibly rare. These are very, very safe products as a result of all the testing that goes into them. These vaccines are also key to public health. And one of the points raised by the earlier speaker is they're key even in communities where sanitation is high. where access to potable water is good. I vaccinate my daughters in spite of the fact that they're well nourished and they have access to water and treatment and care, because I know that even after all the things that I can do in terms of the environment to protect them, there are some infections for which I cannot be there to protect them. They are still at risk. And when I vaccinate them, I sleep a little better. I worry a little less. It doesn't stop me from trying to educate them and teach them to wash their hands and to eat right and all those things, but it's an additional layer of protection. It's also important because it protects the weakest, the most vulnerable in our community. This year in the United States, we had the biggest outbreak of measles that we have had in more than a decade. And we had the first measles death that we've had in more than a decade. The woman who died lived in the state where I live, in Washington State. This is a woman who had cancer, and she was on treatment that was bringing down her immune system. It was helping to get rid of the cancer that made her vulnerable to infections. Even if she had taken the vaccine herself, she wouldn't have responded to the vaccine. The only way that we can protect her is by the people around her accepting the vaccine, by interrupting transmission. That didn't happen. She went to a doctor's office where a patient with measles had been earlier. She contracted the measles virus and she died. It is our responsibility to protect the weakest amongst us, and vaccines are a big part of doing that. They're a big part of protecting the herd, the community around us. The global immunization program success is only a success when it involves the community. When decisions are made by incorporating the diverse traditions, the local leaders, the civil society, and yes, the faith-based community in trying to extend understanding of and ownership for immunization programs. So as trusted community members, you have a role to play, advising families and the public health community alike, being supportive to health workforce and immunization advocacy and outreach. I've seen this firsthand. I've seen in northern Nigeria, imams go hand in hand with polio workers to educate, to talk to parents who may be hesitating, and to make the difference in accepting those vaccines. And I'm sure you have your own stories like that. You can help to build community demand for accessing immunization services. And you can help with your political leaders as well, by also assuring that they remain accountable to the commitments that they've made. And together, I hope that our partnership will save millions of lives. Thank you.
Thank you very much.